Thank you for your interest in our presentation over-the-counter treatment of allergic rhinitis. This presentation will be delivered by Jacqueline, Summer, Courtney, Stephanie, and Anya. To start off, allergic rhinitis is commonly known as hay fever or a pollen allergy. It is an IgE-mediated hypersensitivity reaction, which can be triggered by allergens such as pollen, dust, animal dander, and mold. The pathophysiology involves IgE antibodies binding to mast cells, causing them to degranulate and release histamines, prostaglandins, and other mediators into the tissue. This is particularly intense in the tissues of the nose and eyes, where the high concentration of mast cells cause vasodilation and increased capillary permeability. This is also why allergic rhinitis causes nasal congestion, watery and itchy eyes, and general eye inflammation. Rhinitis can also make people feel irritable and tired. There are a number of ways to manage allergic rhinitis non-pharmacologically. Nasal irrigation with neti pots are popular, but ensure to educate families to use saline or distilled or sterile water. Patients can also be advised to avoid allergens and triggers such as paint fumes and cigarette smoke. Subcutaneous allergen immunotherapy involves administering gradually increasing amounts of the allergen to help mute the immune response and to ease allergic symptoms over time. We will be discussing the following drug classes and how they relate to the treatment of allergic rhinitis. Many common over-the-counter drugs used to treat allergic rhinitis fall into the drug class of first-generation antihistamines. Some examples of first-generation antihistamines include diphenhydramine, often sold under the brand name Benadryl, chlorphenhydramine, and brompheniramine. These medications are histamine antagonists, meaning they block the actions of histamine at receptor sites through competitive inhibition. Unlike newer antihistamines, what is unique about first-generation antihistamines is that they do cause CNS effects such as sedation. They also work on cholinergic receptors, so look out for anticholinergic effects like dry mouth and blurry vision when patients are on these medications. They should also not be taken with other CNS depressants such as azolastine or alcohol. There are a variety of dosage forms, including liquids, tablets, and capsules. While there are forms of Benadryl and other first-generation antihistamines suitable for children, these medications are contraindicated in neonates and infants. It should also not be used to make children sleep, as there can be a paradoxical hyperactivity reaction in children. These medications are also on the Beers list due to anticholinergic effects. Additionally, anticholinergic side effects put patients with narrow-angle glaucoma at risk for increased ocular pressure and can also cause decreased urine flow in patients with BPH.
Okay. Second generation antihistamines were approved by the FDA and became available for use in the 1980s to provide selective H1 inhibition. This specific category antihistamines does not cross the blood-brain barrier to the extent that the first generation do, and therefore does not cause drowsiness at standard dosage levels. A few positive things to note in this group are that they offer longer dosing intervals, have negligible anticholinergic, antiserotonergic, alpha-1 and beta-adrenergic properties, as well as decreased CNS effects such as sedation. A few adverse effects noted are somnolence, dry mouth, pharyngitis, dizziness, nausea, headache, drowsiness, and fatigue. A couple drug-to-drug interactions, plasma levels of desloratadine have been shown to increase in the presence of ketoconazole, as well as concurrent use of loratadine and amiodarone may result in an increased risk of QT interval prolongation. And concurrent use of loratadine with erythromycin and ketoconazole have resulted in significant elevated loratadine serum concentration levels. Grapefruit juice has also been shown to reduce the fexofenadine bioavailability by 60 to 70% due to the inhibition of organic ion transporting polypeptide by grapefruit juice, rather than the alteration of P glycoproteins, resulting in reduced absorption of fexofenadine. Some prescribing considerations in the second generation antihistamines to note are that in pediatrics, it is not recommended to give these antihistamines to children under the age of 2. However, with the exception of levocetirizine, this medication can be given to pediatric patients from ages 6 months to 2 years for perennial allergic rhinitis. but strict dosage monitoring is needed with this medication. The elderly population is a good choice due to non-sedating properties since it does not cross the blood-brain barrier. In pregnancy and breastfeeding, cetirizine and loratadine are FDA category B, and fexofenadine and disloratadine are category C. The second generation antihistamines pass easily into the breast milk, so they're not recommended for use in lactating women or in pregnancy due to the available evidence being inconclusive. And under some of our comorbidities for concern is in hepatic and renal impairment patients. These medications have shown a significant increase in medication Cmax. And in our patients with PKU, they need to be cognizant that the oral disintegrating tablets may contain phenylalanine.
So for the intranasal antihistamines, we have azelastine, which is also known as Astepro or Astelline. Its mechanism of action is a selective histamine H1 antagonist with less of an affinity for H2 receptors. It has mast cell stabilizing properties, which allow it to stop the release of interleukin-6, tryptase, histamine, and TNF-alpha. It also decreases the mast cell leukotrienes, and it inhibits their production and release out of eosinophils. Some adverse effects to look out for are just any drowsiness, nasal discomfort, irritation of the throat or nose, burning or stinging, a cough, dry mouth, nosebleeds, or headaches. Some medications that, of course, there's like drug-drug interactions, which cause some inhibition. So we have bupropion, cytamine, and like these medications may need to be changed in dosage, or just how often these medications are used together with azelastine. Some of the dosage forms that are available, they are also nasal sprays. You have Astepro for children, and then just this generic form. Some just considerations for different populations. For pediatrics, it's not recommended for use in children that are younger than 6 years of age, just due to lack of data. For the geriatric population or just advanced age, there's no specific studies that show problems with this population, but of course, to always take caution due to just age-related liver, kidney, or heart problems. For pregnancy or breastfeeding, just consulting with a provider before use and just weighing out the benefits versus risks of using it. Some of the comorbidities of concern to take into consideration is use of this medication with alcohol, sedatives, or tranquilizers. It can cause some increased CNS depression, and it really enhances drowsiness effects. Kidney disease is a really big one to look out for because it can affect the excretion of the medication and just may also increase CNS depression in the patient. Also, history of just nasal trauma, surgery, or epistaxis and nasal ulcers are also things to look out for when you come to use this medication too.
Next are the intranasal corticosteroids consisting of fluticasone, triamcinolone, mometasone, and budesonide. All of these medications work by inhibiting inflammatory cells and immune modifiers such as mast cells, neutrophils, lymphocytes, and macrophages. They are all locally acting within the nasal cavity rather than systemic by being absorbed through the nasal mucosa. Some adverse effects to be aware of are anaphylaxis and angioedema, and you want to monitor for some nasal stiffness, growth suppression in children, ulceration of mucosal passages, delayed wound healing, and other immune suppression. Some drug-drug interactions to be aware of are the CYP3A4 inhibitors and some other medications that I have listed. And available dosage forms, it's mainly found in metered sprays in different microgram dosages. These medications may cause adrenal suppression in children, which can lead to growth restrictions. Some of the medications have age restrictions as well, such as budesonide can't be used in children younger than 6, fluticasone in children younger than 4, and mometasone and triamcinolone in children younger than 2. There are no specific recommendations for older adults regarding the usage of these medications. As for pregnancy-related concerns, all medications in these categories are category C, except for budesonide, which is category B, and they're all considered compatible with breastfeeding. The decision to breastfeed and take these medications should be based on risk to the infant, need for breastfeeding, and need for treatment. A few comorbidities to be aware of is a history of nasal trauma or surgery, which in case these medications should not be used. And if the patient has a hypersensitivity to alcohol, they should be careful as these medications can cause nasal dryness as well as odor changes.
Cromolyn sodium is an OTC mast cell stabilizer that slows mast cell degranulation in response to allergens. It is important to note that this is not a rescue med, nor does it bronchodilate. So advise patients that this medication should be started 2 weeks before exposure to any allergen, and that it may cause a burning or stinging sensation inside of the nose. This product is available as a nasal spray. There's limited research on the use of cromolyn for special populations. However, it is worth noting that this medication is contraindicated for people having acute asthma exacerbations. It is pregnancy category B and can be offered to help with mild or intermittent symptoms. Often part of combination medications, nasal decongestants such as phenylephrine and pseudoephedrine cause vasodilation, which reduces nasal congestion. These adrenergic agonists have CNS side effects such as dry mouth and insomnia. So caution your patients that overuse of nasal decongestants can cause rebound congestion. These medications cannot be used within 14 days of an MAOI due to risk of hypertensive crisis, nor should they be used concomitantly with SNRIs. Use of nasal decongestants is not recommended for kids under 12 or people of advanced age. These are not pregnancy safe, and pseudoephedrine has been demonstrated to increase the risk of congenital abnormalities with use in the first trimester. Interestingly, it can also decrease breast milk production and cause irritability in breastfed infants. Due to its adrenergic activity, nasal decongestants should not be used by people with BPH, narrow angle glaucoma, asthma, or seizure disorders.
All right, so some medical safety issues to take into consideration. Many of the medications that we discussed have anticholinergic and or CNS depressant effects. Here we've highlighted Benadryl due to its anticholinergic effects and presence on the Beers list. To avoid exacerbations, narrow angle glaucoma, or BPH, carefully complete a medication reconciliation with all patients to make sure to ask about over-the-counter medication use as well. And then levocitrazine is also excreted in the urine, which has important implications for patients with renal disease. It's also contraindicated for patients on dialysis. So you want to consider checking a serum creatinine before prescribing to renal patients. As far as purchasing in Costco, based on our trips to the pharmacy, we determined the costs of a course of each class of medications, utilizing the common dosage and frequency for 2 weeks of allergic rhinitis symptoms. Since cromolyn needs to be started before contact with allergens, its cost is based on a 4-week course, and then the phenylephrine is based on a 1-week course because that's the maximum duration of use. We also use lexicon to determine the dosages and frequencies for all of our medications. And then this slide over here also just shows our prescription options for other medications that we could also utilize for allergic rhinitis as well. Thank you so much for watching our presentation. And then here is a list of our references.